Hi, it's Dr. Esposito. Welcome to Advanced Rehab at Jersey City, where we've been seeing patients here for 9 years. I've been in private practice for about 20, and in that time I've helped patients get out of pain, reduce disc herniations, and lose weight, all naturally. In 2008, I was a team chiropractor for the Newark Bears, where I learned a lot about sports injuries. I am a DOT certified medical examiner. I'm a cancer survivor. I lecture routinely to cops, firemen, teachers, and corporations about losing weight and getting out of pain and reducing their stress. And lastly, I formulated with Dr. Liviero a powder called Super Powder. It's protein with all your daily vitamins and minerals to make you healthy, to curb appetite, and enhance athletic performance. So many patients ask, what's my problem and how long it'll take and how much will it cost? What most patients have is what's called a spinal subluxation. That's a misalignment of the vertebra causing interference between the brain and the body. That causes excess wear and tear on the joints, the muscles, ligaments, and tendons. This can result in disc herniations, arthritis in the joint, spinal canal stenosis, which many older people have. So if people were checked for subluxations or misalignments, you could prevent and reverse the effects of disc herniations. So subluxations are common, but they're not normal. People get into car accidents, causes the spine to jolt, either from the back or the side, falls, or even sitting at a computer abnormally for many, many years. Typically what you're feeling now is a result of what happened 3 to 5 years ago. Some patients that get into car accidents feel the pain immediately, but sometimes they don't feel the effects until 10 years later. So what you're feeling now is typically something that happened many, many years ago. Subluxations definitely can cause pain, but a lot of times you will just not feel right for many, many years, where your body is in a state of dysfunction, where the brain's not able to properly send signals down to the body because there's interference in the spinal column and spinal nerves. What we do to treat it is we'll take x-rays to see where the spine is kinked out of alignment, interfering and causing dysfunction in your body, and then we'll gently retrain the body back into a position. It takes time. It takes anywhere from 2 to 3 months. Typically, if you've never been to a chiropractor before, you'll need more care because there's no muscle memory there. In addition to pushing the bones back into alignment, we now have to strengthen and stretch the tight and weak muscles associated with that misalignment that occurred from many years ago. Spinal subluxations will affect nerves that go to muscles, and will affect the nerves that go to organs. So for example, a bone that's out of alignment will affect the nerve that goes to the neck muscles, but also affect the nerves that go to your thyroid and affect your energy and blood flow to your head. A nerve over here may cause mid-back pain or shooting pain down to your hands, but that same nerve goes to your lungs, going to affect asthma and how you take oxygen in and out, or can affect your heart rhythm. Lastly, a bone out of place in your lower back can definitely cause a disc herniation, can cause pain down the leg, or what people know as sciatica or chronic back pain. But that same nerve goes to reproductive organs, affects your menstrual cycle. I wanted to show you the effects of spinal subluxations on the entire body. So a bone out of place here can affect the thyroid gland, can affect the nerves down the arms. One, the lower back can cause leg pain, sciatica, also affect the reproductive organs and the digestive system as well. Now, one of the ways we know when you're done with chiropractic care is after 2 to 3 months, we'll take a new x-ray and see the new positioning of the bones, okay? The pain will be gone very, very quickly, within a week or two, but we will not know until you're fully corrected until we take a new x-ray, or we're able to see when you lay down the table if one leg shorter than the other, now it looks more even, or if your shoulders look more correct when you stand or lay down. We'll know that the stress is being taken out of your body. Now, the last thing I want to talk about is everybody in your family should get checked for a subluxation. When you have a subluxation, there's dysfunction. The body doesn't feel right. 20 years later, 10 years later, it'll manifest in pain. But kids are prone to subluxations from learning how to walk and falling, from the way they're pulled out of the birthing canal, to playing one-sided sports or sitting at desks at the school, or the common thing now is their head down playing video games or talking on their iPhones. It causes a lot of stress in the neck. So you should always get your kids checked for a subluxation. We would look for if there's one leg shorter than the other, if they have slouch posture, if that when they wear their pants, one leg's higher than the other. So get your kids checked for subluxations because it's more common than you think. In a few moments, one of the doctors or myself will come in to review your findings or x-rays. Don't forget at the front desk to ask Jackie or Dr. Emma for a free sample of super powder. That's the one serving. That's the weekly draw that people take. And to get your kids or grandkids signed up for a free evaluation in the office to make sure they don't have any spinal subluxations or stress.